Hello, welcome to our case study. My name is Jessica Luth.
My name is Catherine Peterson.
I'm Jessica Hatch.
Amanda Masood.
Yoshiko George.
Kate Sweet.
And we're going to be discussing a 65-year-old Buddhist female who is at home recovering from a recent myocardial infarction. So the Buddhist faith is typically a holistic faith. They have a lot of regimens and specific requirements. So we would focus on, since the patient is at home and in home health care, we would provide an aid that would be of the same gender, because that's something they typically require.
And it would be really important to respect the patient's autonomy because Buddhists are very aware of themselves and it's very important to them to be a part of their care. It should be a very patient-oriented approach, and any education needs to have a middle ground between the doctor's knowledge and the patient's perception.
So another talking point that's incredibly important is the Buddhist diet. It's typically vegan, but it's also important to understand that a lot of the junk food is vegan as well. So it's important in teaching them dietary intake. So low cholesterol, low fat diets, not eating Oreos and eating an apple. So it's important to do that.
Many Buddhists will refuse pain medication because they're worried about having a clouded mind. So it's very important to educate them that certain pain medications like ibuprofen or Tylenol do not cause this. And it would be important to educate them about the medications they're going to be taking at home for their MI recovery, such as ACE inhibitors, antiplatelets, beta blockers, and how to further control their heart condition.
Another thing to consider is Buddhists like to sleep on the floor. Sleeping on the floor is not optimal for somebody recovering from an MI.
Right.
So discussing the different options for sleeping arrangements is super important.
Buddhists are also very strict on hygiene, so it would be important for the home healthcare aide to understand that they need to wash before meditation, urination, and defecation and make sure that they really understand their needs.
Another important talking point is education on smoking causation. Some Buddhists smoke, some do not. So educating them on avoiding secondhand smoke and other pollutants is very important.
Okay, another topic that I wanted to talk about regarding the Buddhist culture is their environment. So with this, it's important that we incorporate their environment into their plan of care. And one example we can do this is by making sure that we have a Buddha at the bedside. Additionally, we want to make sure we give them enough time and space to do meditation in a quiet, calm environment for healing purposes, and so that they can reduce stress, which is very important when we're talking about, recovering from an MI. Also, they do value neighborhood walks and low impact exercises. So, and early ambulation is very important in healthcare. So this is actually perfect. We can get them up and walking around, and this will help lower their blood pressure and increase their cardiovascular health. And last but not least, we want to give them time to practice Dharma. This is very important to them. So this is ridding yourself of negative thoughts. And again, they believe that this can lower blood pressure and relax the body. So all of these together are very important to healing from MIs.
So before we educate Ms. Smith about her MI, we need to make sure we know what language she speaks, because Buddhist culture has many different languages spoken. So if she does speak a different language, we would need to get a translator or maybe a family member in the room to help her understand the education. Buddhist culture, they're very family oriented. So when we do educate Ms. Smith, we should involve her whole family, just because heart disease and MIs can be genetic. And then Buddhists also analyze everything very logically and systematically. So it is important that we educate Ms. Smith with as much knowledge as possible regarding the background of MIs and how they happen, and then how to treat them. And then when we do give her treatment options, we want to make sure they're very logical. Buddhists also follow something called Four Noble Truths, which basically talks about how there is suffering and then there is a way to end suffering. And to end this suffering, they follow an eightfold path. And this includes right understanding, right thinking, right speech, right conduct and action, right livelihood, effort, mindfulness, and concentration. And by following this eightfold path, we can tailor their plan of care to help Ms. Smith better understand her MI.
And so to kind of sum up what we've talked about today, we all know it's very important to integrate Miss Smith's beliefs into her care as much as possible. And I think the first step in doing that is assessing exactly what she believes and how she feels about having the MI and how that impacts her life. But some ways we can preserve those beliefs is to make sure we're giving her a home health nurse who is female, if that makes her more comfortable. Making sure that nurse knows that she might be practicing a vegan diet, and making sure, to ask her how easy or difficult it is to access, vegetables and fruits and healthy foods. It's also important that we can discuss with PT that meditation might be very important to her, and making sure that that is integrated into her care, as well as, again, emphasizing that she continue to abstain from smoking or drinking alcohol, and also encouraging her to reduce her stress and
Meditate
daily.
Some ways that we can accommodate or negotiate with her culture and beliefs, if it's harmful to her or isn't as great as some of the other things that she does. We can talk to her about end-of-life care and discuss her wishes, because in Buddhism they tend to leave the body for an extended period of time. So that may not be the best thing if it's not in the home. So we can talk to her, if she wants to be cremated, if she wants to stay at home, we can talk about that. We can also explain the need for medication adherence and emphasize that medications will not inhibit her mental status, like nitroglycerin, calcium channel blockers, diuretics, etc. And just respect that they want to feel whole in the experience, and Ms. Smith wants to feel whole. And then again, we were talking about sleeping on the floor. This may not be optimal for someone that has an MI, so we can discuss other options at home and with her family. Some ways to repattern, which, this is when her decisions are completely harmful to her. Luckily, in Buddhism, they're a very accommodating and tolerant religion, so they tend to take on what doctors believe and what nurses believe, because they think of medicine as in a high regard. So we would need to make sure that this isn't a bad thing, but that she has a voice in her care, and that she's calling the shots, and that it's not just us giving her information and she's just taking it all in. Because there are very peaceful and tolerant people as a whole. All right, but yeah, that's it for our healthcare case study. Thank you for watching, and hope you enjoyed it.
Thank you.